American Cancer Society says the number of adults under the age of 50 being diagnosed with colon cancer in the U.S. continues to grow. One surgeon from right here in our state is using his own experience to help spread the importance of getting screened. 1011's Matt Kirkle had the chance to sit down with him and learned just how easy it can be to ignore the signs.
Dr. Rick Thompson is a heart surgeon and the president of CHI Health Nebraska Heart Hospital right here in Lincoln. And even though he specializes in cardiovascular health, he understands the importance of colorectal cancer screenings. That's because over a decade ago, one of those screenings likely saved his life.
Dr. Thompson says he ignored all the signs.
Surgeons tend to not seek health care. You would think we would be good at being patients, but we're not very good.
13 years ago, he noticed blood in his stool. He thought it was probably hemorrhoids and ignored it. That was until he brought it up with a gastroenterologist that he knew.
And I told him about my symptoms, and he was like, "Rick, we need to do a colonoscopy like tomorrow."
And even after that conversation, he still didn't think of cancer as a possibility.
I had had no family history of any sort of colon cancer, so I was like, I'm definitely in the clear. There's no problem.
But at the age of 37, that possibility became a reality. And being in the medical profession, processing a cancer diagnosis was particularly tricky for Dr. Thompson.
It's really hard when you're a doctor and you get a diagnosis like that because everyone wants to do what you want them to do. So it's really hard to get an honest opinion from a doctor.
He ended up going into surgery to remove a third of his colon, and after some testing, he learned he was cancer-free. But going through all of that pushed him to want to help others that find themselves in his shoes.
It's so important to catch colon cancer early. It's one of the cancers that if you catch it early has such a great cure rate.
And he pushes everyone to look for those red flags and act when you see them.
Do not ignore it. Take it seriously. Even if it is hemorrhoids, it's okay. Just get a professional to make that diagnosis and make sure that it's not something more serious.
Dr. Thompson also tells me that early detection is becoming more important for health officials. The U.S. Preventative Task Force recently decided to lower the recommended screening age for colon cancer from 50 to 45.